Reporter Manos Anguri joins me now from Sydney. Manos, can you give us some more detail on today's numbers?
Good morning, Karina. Yes, like you mentioned, overnight New South Wales recorded 92,264 new cases. That is, of course, the highest we've seen, but we were expecting such high case numbers today since it was the first time that we were including rapid antigen test results in our daily case numbers. Of those cases, 61,387 are from rapid antigen tests since January the 1st, and 30,877 are from PCR test results, which is down from yesterday's 35,759. We also had 22 deaths overnight. That is the highest we've seen since the pandemic began here in New South Wales. Yesterday we had 21 deaths. 7 were historic from yesterday's numbers. There's currently 2,383 people in hospital, up from yesterday's 2,242, and 182 people in ICU, up from yesterday's 175. Our vaccination rates are still at 95.1% of the population over the age of 16 who have had one dose, and 93.7% who are now fully vaccinated.
As you said there, Manos, 7 of the deaths that were reported out of the 21 yesterday were historical, and that was after the coroner deemed them to be COVID-19 deaths. I guess we don't have the breakdown today of whether any of the 22 that have been reported today are historical at all.
Yeah, we will be getting a more detailed report probably around 11 o'clock, which is when we get some more details. We get breakdowns on cases, which regions have recorded the largest portion, and we also get a breakdown of the deaths, and we get to know whether any of the 22 of today's deaths were historic as well.
Okay, so we'll know that in a couple of hours. Positive rapid antigen tests have to be registered now, but they're still very difficult to find.
Yes, well, we know that the New South Wales government has ordered 50 million rapid antigen tests, and they are trying to get 50 million more to hand out to essential workers, people like teachers, healthcare workers and transport workers. But the National Cabinet had decided that free rapid antigen tests wouldn't be given to the wider community. So the New South Wales Premier Dominic Perrottet had instead said that he was looking into a voucher system which people can use in supermarkets or pharmacies. He says he acknowledges that rapid antigen tests are still very difficult to get here in New South Wales, but he is expecting providers to step up in the coming weeks.
And what's the situation with aged care in New South Wales? I understand that there are a lot of aged care residents in lockdown.
Yeah, well, the Aged and Community Services Australia have said that more than 300 aged care facilities in New South Wales are struggling with the COVID outbreak. They're saying that anywhere between 5 to 50% of staff have been impacted by either contracting the virus themselves or becoming a close contact. Now, daycare facilities are also struggling. Centres are saying that the government just isn't being clear with instructions on how to deal with COVID situations, which is causing a lot of confusion. It's also causing frustration for parents who say they have to isolate their kids at very short notice, which is extremely difficult, especially for parents who work, who've already exhausted most of their leave.
Manos Anguri reporting from Sydney. Let's go to Victoria now, where 25 more people have died. The state has recorded more than 37,000 new COVID cases. Reporter Andrea Nierhoff joins me now from Melbourne. Andrea, take us through the latest numbers.
Hi, Karina. Yes, Victoria has reported 37,169 new cases of COVID-19. As you mentioned, sadly, another 25 deaths have been added to our toll as well. 953 people are in hospital. Now, our hospitalisations yesterday jumped from the day before by around 100 people. So fortunately, that jump overnight has not been as bad. But 111 people are in intensive care. Of that, 29 people are on ventilators as well. We've pretty continuously seen the number of new cases fairly evenly distributed between positive rapid tests and positive PCR tests. Similarly, today, 16,843 are from rapid tests, 20,326 are from PCR tests as well. Now, overnight, we also saw a few new restrictions come into place. All indoor dance floors at entertainment venues are now closed. Unless you're at a wedding, there you can still dance, but it is advised to hold that outdoors wherever possible. available. We've also got new restrictions around visitors to hospitals, also to aged care facilities. A booster mandate has come into place for several key industries, and also some workers who are considered close contacts in several sectors don't have to isolate as long as they are asymptomatic and also do daily rapid antigen tests. But with our active cases now at more than 221,000, that figure, of course, looks like it's going to remain worryingly high.
Yeah, and we're seeing staff shortages in so many sectors, but there are even more industries being hit now.
Yes, of course, we have seen workers in the healthcare, emergency services and also food distribution sectors being hit quite hard with staff shortages. And now we're seeing that hit also workers in the hospitality sector, understandably, but also things like garbage collection. We've got two councils in Melbourne, Moreland and Monash, have said that they are seeing delays of up to 24 hours in rubbish collection. And we're also hearing reports that that could be hitting other councils as well across the city. One of the state's biggest waste collectors, Cleanaway, has said that it's looking at prioritising COVID testing sites, hospital sites, also other medical waste centres over that residential rubbish collection as it tries to deal with staff shortages as well. It says at least 150 staff per day are being furloughed due to the virus. The federal government says it is considering adding the waste collection industry to that group of people who fall under those COVID isolation exemptions. The Victorian opposition, though, is calling for small businesses to be provided with some relief, some financial relief as they struggle to cope, while the Australian Nursing and Midwifery Federation has said the government should definitely not allow workers who are COVID positive but asymptomatic back into places like hospitals. It says that that is a step too far. Of course, we'll have to wait and see what comes out of National Cabinet today. The Victorian Premier has been back from leave for a few days now. Hopefully they will provide some relief to those sectors really struggling at the moment, Karina.
Andrew Nierhoff with the latest there from Melbourne. Let's take you to Queensland, where surging case numbers continue to put stress on thousands of medical workers, and anger over the lack of rapid antigen tests is continuing to grow across the state. Reporter Michael Rennie joins me from the Gold Coast, which has been deemed a COVID hotspot by health authorities there. Michael, how are workers responding to the lack of rapid tests?
Oh, it's been extremely hard on businesses, and you just see everywhere you go, really, particularly supermarkets at the moment, there's a lot of empty shelves, and I think that's a similar case around the country. But getting those rapid antigen tests is extremely difficult at the moment. If anyone's tried to get one, you can be driving from store to store looking for them, and they're just nowhere to be found. In fact, some chemists, Karina, are actually taking waiting lists for people who want to get some of those rapid antigen tests and then calling them back when they are available. But that is, of course, because of the growing case numbers that we are seeing in Queensland. People are nervous, they want to get tested, and it's hard to get a PCR test now. At the moment, we've got 525 people being treated in hospitals like the one I'm at this morning, the Gold Coast University Hospital. That's right across Queensland, though, that number. And then here on the Gold Coast, I believe they have around about 10 people in intensive care at the moment. But across Queensland, it's now up to 30 people in ICU and 8 people on ventilators as well. To give you an idea about how quickly it's changed here as well, we've gone from having 56 cases on December the 13th to now we have over 130,000 cases across Queensland. So by that, it just shows it's just exponential growth, and they are expecting that peak of growth to really be around the end of January. But yeah, for the rapid antigen test, we've seen the Queensland Nurses Union saying that this should have been planned months ago. How did we end up in this situation where we're needing all these rapid antigen tests now? Why wasn't this thought about earlier? But hospitals like this one, the Gold Coast University Hospital, they are prepared for what is to come. They have been thinking about worst case scenarios as well, and they've got some detailed plans about what they would do if things got really bad with case numbers. We spoke to Dr. Jeremy Wellwood. He is the Executive Director of Medical Services here at the Gold Coast University Hospital. Let's hear what he had to say.
From having not very much back in December to having literally thousands of cases here on the Gold Coast. We have 6 dedicated COVID wards, but we know we can bring on the capacity we need. So we've got it covered, but gee, it's busy. There's lots of challenges ahead. It's going to get worse before it gets better, but we know we'll be able to get this done for the community.
Michael, what are authorities saying about when more rapid tests will arrive?
Well, we're hearing, Karina, from the state government that they're expecting 1 million rapid antigen tests to arrive next week from the federal government. And you're going to need a lot more than that, though. And I think a lot of private businesses are also ordering tests as well. And we're going to see that turn around, and we're going to see a lot more tests coming in because COVID is starting to touch every corner of Queensland. I think there's only 2 local government areas in the state that still haven't had any COVID cases. And like I said, we are expecting that peak to be around late January. And in fact, the Chief Health Officer, Dr. John Gerard, says that we should be seeing a lot more cases than what we are currently seeing within the next week.
Michael Rennie with the latest there from the Gold Coast. Major changes to South Australia's COVID testing regime have kicked in, with close contacts of positive cases now able to test at home from today. Charles Bryce is in Adelaide. Charles, what are the new testing rules?
Morning, Karina. Well, those who identify or are told by SA Health that they are a close contact will then be able to register with SA Health. They'll then be able to come here to where I am today to collect 2 rapid antigen tests to be used on days 1 and day 6. They'll then have to upload those results. They'll then be used as official data. If the results are positive, they'll then have to isolate for 10 days. One of the big questions, though, Karina, is whether there are enough rapid antigen tests here. We have seen them sold out across chemists and supermarkets in South Australia. The government says that they have ordered around 10 million rapid tests, with approximately 1 million of those coming into the state each week. If you are a close contact, though, you will have to use those rapid antigen tests that are provided by SA Health.
And people are being told to expect disruptions?
Yeah, that's right. Things aren't expected to be smooth sailing here, and one of the reasons for that is because there is only one collection point at the moment. We have seen earlier this morning the lineup to get in here was well over 2 kilometres, although it is quite a fast moving line, which is quite the opposite as what we've seen at the PCR lineups here in Adelaide. There are expected to be about 12 collection points within the week. They'll be over metropolitan Adelaide and in regional South Australian today. If there are no collection points nearby where you live, you are still able to get a PCR test.
Okay, Charles Bryce reporting from Adelaide. State and territory leaders will consider a plan to relax COVID-19 isolation rules for essential workers today. It's hoped the plan will allow many workers to get back to the job as the nation's supply chains buckle under the weight of surging cases. Political reporter Matthew Doran is in our Parliament House Bureau. Matthew, is this plan likely to have broad support?
Well, it certainly has support from industry groups who've been calling out for some changes to the isolation rules because they are suffering from crippling staff shortages at the moment, with so many people in isolation across the country having come into contact with positive COVID-19 infections. We know that the Prime Minister is in favour of expanding these exemptions from those isolation requirements. We'll wait to see whether or not state and territory leaders are of the same opinion, even though some have already acted on that in New South Wales and in Queensland for certain workers. What this proposal that's been drafted by the AHPPC, which is the peak health body made up of health bureaucrats and doctors across the country, has proposed is an expansion of the model that's currently in place for some food and grocery workers and also emergency service workers. So if an individual comes into close contact with a COVID-19 case and they're asymptomatic, they can take a rapid antigen test. If they return a negative result, they can get back to work subject to the broader testing requirements that might be in place in their industry or by their employer. This would expand it to a wide range of occupations. We're talking everyone from healthcare workers through to teachers, even real estate agents have made the list. The full list is on our website, the ABC News website at the moment, if you want to check it out and see if you'd be among them. And it goes further as well to outline the sort of rules that would be in place for example, someone who's considered a high-risk contact. So if a family member that you're living with tests positive for COVID, but you still need to go into work, this also outlines the process there that an individual would have to take rapid antigen tests every 2 days to be able to continue working in that environment. So we'll wait to see how the states and territories agree or disagree, or if there are any tweaks to this model after National Cabinet today, which is expected to start meeting from around midday Eastern Daylight Time. The opposition leader, Anthony Albanese, says that there is a need to get more workers back into the workforce, but he's criticised the lack of planning, in his words, the lack of planning that's been put in place ahead of this surge in Omicron cases. He says that the union movement in particular has been raising and ringing the alarm bells for some time now, and he says that any changes to workplace requirements need to be done in consultation with those who it affects.
We need to have a proper consultation with working people, and it needs to be worked through like it was at the beginning of the pandemic, where the trade union movement and its representatives put aside wages, conditions, did the right thing to keep the economy going. What they need is a government that is now prepared to back them. Working people have been saying that they needed access to testing, for example, for months after months.
Matthew, what else is on the agenda at National Cabinet today?
Well, Karina, considering that we're talking about the requirement or the desire to get more workers back to work and the need for them to access rapid antigen tests, you can bet that premiers and chief ministers will be discussing the supply constraints that are currently on rapid antigen tests across the country, what the Commonwealth is doing to secure more supplies, and whether or not those tests would be able to be handed out to those workers who would benefit from this expansion of the isolation exemptions there. The Deputy Prime Minister, Barnaby Joyce, says that the government has already made the announcement that people with concession cards will be able to access rapid antigen tests through their local pharmacies, but he's been pressed this morning as to whether or not the situation facing the country is further fueling the need for rapid antigen tests to be made free and available to the broader population. Here's what he had to say.
We're bringing them in. I don't know whether we're going to be funding them. We're bringing them in. We'll make sure we'll facilitate them. I imagine if we're paying them, we're going to be funding them. But nothing's free. When you say, are they free? You're the taxpayer. You just pay for it.
That's the Deputy Prime Minister speaking earlier today on Channel 9, repeating some familiar rhetoric from the federal government on that issue. We're also expecting to hear some planning around the return to school, something that would be at the forefront of many Australian families' minds at the moment, with the child vaccination program having just started and experiencing some teething issues across the country. What needs to be put in place to ensure that kids can get back to school and, in the Prime Minister's words, stay in school. We know some states have already started to tweak their own plans there, so this is going to be more of a discussion about the overarching principles rather than some sort of rigid framework, every Premier and Chief Minister adapting the situation to their own circumstances. Karina?
Matthew Doran reporting from Canberra.